Welcome back to Food for Thought 2020. I'm Fiona Godley, Editor-in-Chief of the BMJ, and it's my great pleasure on behalf of the BMJ and the Swiss Re Institute to open the penultimate session of this virtual conference on the science and politics of nutrition. We've had some really great discussions yesterday on diabetes reversal and salt reduction, and this morning on the importance of food for mental health. And it's been particularly great to have your discussions via questions posted on the chat function. Please do keep them coming, and we will do our best to feed them into the discussion. Please also tweet on hashtag #FoodForThought20, and you can view recordings of all the sessions on the Swiss Re website. You can also read the articles that have been published in the BMJ at bmj.com/foodforthought20. From 4:55 Central European Time, we will have a panel discussion on how to improve nutrition research. But now it's my huge pleasure to introduce as moderator for our panel discussion on food systems, BBC broadcaster, former presenter of the food programme on BBC Radio 4, and champion of good and sustainable food production, Sheila Dillon.
Well, thank you very, very much, Fiona. It's an absolute delight with my technical problems to join in this discussion and to moderate this discussion, especially from doing it on behalf of the BMJ and Swiss Re, because it has been it's been an enormous encouragement to me as a food journalist to see how the BMJ has been in the lead at bringing nutrition to discussing medical systems and just bringing the two things together, which seems to me so profoundly important. The panel that is gathered together just seemed to me one of the most exciting groups of people to discuss this big topic, reimagining food systems to promote health in the wake of COVID-19. Because as we heard from other sessions, especially this morning session on food and the brain, that food, our diets are absolutely the leading cause of sickness and early death worldwide. So we have food systems that really need rethinking. So to begin our talk, to begin our discussion about how we rethink, we're going to begin with Alison Aubrey, who is a journalist. She's a correspondent on National Public Radio for food and nutrition. She's the founder of National Public Radio's food blog, The Salt. She's won 2 and more James Beard Awards for her work on the nexus of the pleasures of the plate and the politics of food. So, Alison, how do we start reimagining food systems to promote health?
Well, I guess first you have to understand the systems that guide and influence how and what we eat in this country. And when I think about systems, there are multiple systems that guide that here in the US. For instance, there are school systems. That is a more traditional way to think of a system. You have a superintendent, and the superintendent tells principals what to do, and principals tell students what to do. And within the school system, we've actually in this country made some good progress in having the plate represent, how we should be eating, right? In this country, going back to the work Michelle Obama did, we've really made progress in modeling good eating through what we serve children in schools. So that would be an example of a system that can work. Unfortunately, I think the more dominant system in certainly in this country is the free market system, and basically the way that works for all its good and ills, the way it plays a role in shaping what we eat is that, the companies that can produce this most savory food, usually full of salt, sugar, and fat, and sell them at the lowest price, gets a big market share because that's what people can afford. And so I think that this pandemic really does shine a spotlight on the fact that eat the way you're supposed to be eating requires a fair amount of resources and wealth, and there are just far too many people here in the U.S. and around the globe that can't afford this. And so I think that lack of resources and low income and poverty is just a huge driver of the the result is a huge driver of metabolic disease. And right now we're learning that people in this country, in the US, this is new CDC data, people with type 2 diabetes, obesity, hypertension, or heart disease, hypertension being part of that, are 12 times more likely to die and 6 times more likely to end up in the hospital with COVID-19. And so what we're seeing is the convergence of lifestyle disease, and I hate to call it lifestyle disease because people develop metabolic disease largely for reasons oftentimes for reasons they can't control. But people with metabolic disease this is showing the convergence of lifestyle disease and infectious disease, and the result is really awful and scary, and shines a spotlight on the work we have to do to empower people and help people eat better.
Thank you, Alison. Let's go to with a point of view rooted in the United States. Let's go to Anna Larty, who is Director of Nutrition at the UN's Food and Agricultural Organization and former head of the International Union of Nutritional Scientists. She's trained all over the world, from her birthplace in Ghana. So, Anna, your reaction to of our discussion today.
Yeah, thank you very much, Sheila, for this opportunity. I think let's look at the food systems. In FAO, we've been talking about food systems. Food systems include the mechanism, the processes that are involved, including the institutions that result in the food that lands on our plate. The truth is that our food systems, as we have them, are not delivering what we want them to deliver. They are faulty. For example, the world produces enough food. The world produces enough food to feed everybody, and yet we have 820 million people go to bed hungry. Not only that, also our food systems are not delivering on healthy diets. We talk about having people eat healthy, and yet we produce the food that we don't want people to eat more of cheaply, so that it's so expensive for people to eat healthy diets. Our food systems are not sustainable. Not sustainable. Food systems now produce about 30% of the greenhouse gas emissions. The food systems are also destroying biodiversity loss. So with all of this, there are problems with our food systems. COVID is just adding on a layer of challenge, okay? So what we are seeing is that COVID has actually opened up the gaps in our food systems, that we know the food systems are not going where we want it to go, and we need to do something about it. And there is a lot that can be done. And I think first it starts with governments. Governments have to take responsibility to ensure that our food systems are working well. They have been entrusted by the people to make sure that the foods that are in the community are healthy. They put in policies to produce the nutritious foods that we want people to eat. So the responsibility first falls with governments. Secondly, we also need to protect people within the food systems. You know, when the health crisis came, immediately there was attention on health issues. That is good. But also there are people behind the scenes who produce our food. The conditions under which they produce the food that we eat are terrible. We need to look at the situation of people who produce our food for us. The other thing is that if you look at what happened with COVID, is a school feeding program. Within months of happening, a lot of children, about 368 million children, lost a very important part of their diet, which is the school feeding program. How can we, within a pandemic, still ensure that we put in place the structures that will encourage and enable children to have the healthy diets that they want? I think that if we are talking about reimagining food systems, innovations are critical, technologies are critical. You know, without these, we cannot do what we want to do. I think COVID is actually pushing us, because we've all been talking about, you know, transforming our food systems. We have not had the guts or the strength to do it. COVID is let's take it as an opportunity to push us where we've not been able to push and do the changes that we really want to see in our food system. Thank you very much.
Thank you very much, Anna. And let's go now to Bhavani Shankar, who was until recently Professor of International Food and Agriculture and Health at the School of Oriental and African Studies at the University of London, and he's now a research fellow at the Institute for Sustainable Food at the University of Sheffield. He's an applied economist and that rare person who's working at the intersection of food, agriculture, and nutrition and health, and he's doing that all over the world. Bhavani.
Hi, everyone. So I'd like to emphasize two things. The first is about the need to build resilience in our food systems following COVID. And the second is about equity, which I think is absolutely vital. So resilience first. I'd like to talk about how it is really important to invest and build food systems that are resilient for the future, that have a long-term perspective in mind. And I'd like to emphasize the fact that it's particularly important to do so with nutritious foods like fruit and vegetables. Now, fruit and vegetables, we know, are absolutely vital for our long-term health, for fighting cardiovascular disease and the role they play in fighting cancers. But they're also very important in preventing infection. So a particularly vital category of food in terms of nutrition security. So how can we reimagine our food system so that this absolutely vital category of food is available to us even when a shock hits? That could be an epidemic or infectious disease shock like COVID, it could be a political shock, it could be a trade-related shock. We need food systems that are resilient in the face of these kinds of shocks. So how do we do that? What is resilience? Well, resilience is essentially, in this context, all about diversification, I would argue. Anytime you have a lot of risk in a system, the answer typically tends to lie in diversity. Whether it's in stock markets where risk in returns to the stock market is actually mitigated through diversifying your portfolio of shares. Likewise, if you're investing in the food system, you need a food system that is diverse, where the supply chains are diverse so that if one part of it is affected, another part can pick up and supply what is missing. So what we perhaps need is finding a way to get the local, the shorter food supply chains that are available in countries to coexist with the long supply chains that are the predominant means of supplying us with food now. Now, don't get me wrong, I'm not saying these long supply chains can be completely done away with. That is probably unrealistic. But can we find a way to get the short food supply chains and the local chains to coexist with the long ones? Can we build this diversity in? How would we do that? One way to do it is to start with nutrition policy. Anna talked about government's role. That is absolutely vital. If we can design food policy that is nutrition-oriented, specifically horticultural policy that is nutrition-oriented, that is a good start. Now, this happens in almost no country in the world. Horticultural policy tends to become commercially oriented. If you look at India, for example, the horticultural policy is all about exports. So can we redesign policy that is more nutrition focused? The second thing in the solution space there is, can we invest in local systems, inject some local democracy in terms of planning food systems? And we're seeing around the world some promising signs, city-level initiatives for organizing nutritious food deliveries that are really interesting. Can we upscale these? Can we scale these up? Can we mainstream this across the world? Is it possible to do that? We might have to come up with creative solutions, like, for example, thinking about peri-urban horticultural production and funding it through some sort of crowdsourced funding from within the citizens of a city. Can we think of these kinds of local level creative solutions? So that's one thing. Now, equity, I would argue, is even more important because supply inevitably tends to adjust. But the problem really lies where people are not able to get the nutritious food that they want. And one thing that COVID has shown is that our food system is extremely unjust. It's good at delivering at an aggregate level, perhaps not as good at delivering to all sections, all segments of society. Alison's just talked about equity in the context of America. That's true all across the world. There is a major problem with food systems and equity. First of all, there is an equity problem with poor people being predisposed to the lifestyle diseases that COVID makes much, much worse. Secondly, there's a problem with poor people being compelled, essentially, having no other option but to go out and work to feed themselves, to go out to the food markets and get food. In lots of countries in the world, having your food delivered to you is not an option for the poor person. You'll have to go out to the market and expose yourself to the infection that's there. But also, buying food, it's the poorest who have the worst diets, partly because things like fruit and vegetables are expensive sources of energy. And so there is a real affordability problem there. So there is inequity on so many levels there. And how do we get past this? And I would argue that that's the number one focus that we need in food systems around the world. And there are solutions there. There are safety nets if you continue to invest in. Countries that really invested in those safety nets, like those school feeding programs that Anna talked about. In India, for example, they were able to step up and continue to provide nutrition to children during COVID. Countries that have had good cash transfer systems have been able to step up. So investing in these long-term solutions, these social safety nets, is really important. Food redistribution. So all the food that wasn't going to the food service sector that was being wasted because of lockdown, some organizations have very creatively redistributed them amongst the poorer people, and that's made a real difference. So those sorts of initiatives, can we find a way of mainstreaming and encouraging them? And finally, targeting geographies where, for example, poor people live, identifying where they live, what they eat, what they're constrained by, and so that when there is a shock of this kind, being able to target those areas and being able to target those subpopulations is absolutely vital. And for that, we need a much better data collection and monitoring. Thank you.
Thank you very much, Bhavani. And finally, we talk to B. Wilson, who is a historian with a doctorate from Cambridge on early French utopian socialism, and a food writer who has applied her intelligence and her scholarship to a series of books that unpeel the role of food in our lives. And she began with a book called The Hive, the story of the honeybee, through First Bite, How We Learn to Eat, and most recently, The Way We Eat Now, Strategies for Eating in a World of Change. She's also the co-founder of the Taste Ed organization, which is helping children to love and feel confident around food. B, I can't see you, but I hope everyone else can.
Oh, can you not see me? I can see you, and I can see Bhavani, and I can't see anyone else anymore. I hope it's...
Yes.
Can you not see me? Or am I invisible?
You're invisible, so speak on, B.
I will speak on. I agree with everything that all of the other participants have said. I wanted to raise two subjects following on from things that have been said, and they're interrelated topics. The first is ultra-processed food, and the second is preference. So I feel that one of the really important ways we need to think about food systems in the post-COVID world is really redrawing the lines of food policy and nutrition to acknowledge the harm being done by ultra-processed foods, following on from the work of Carlos Monteiro and others in Brazil. And actually, one of the recent papers published in the BMJ just this week, in conjunction with this conference, was by Jean Adams and co-authors, which was trying to look at the extent to which public health policy needs to take account of the harm that's being done to human diets and therefore human health by these ultra-processed foods, which now in developed countries make up 50% of the calories that the average person ingests every day, and which we now know from multiple associative studies, but also now one study by Kevin Hall and colleagues that actually studied it in a controlled environment, that these diets are linked to higher rates of obesity and higher rates of all of the preventable NCDs, which is so heavily implicated in worse outcomes for people who get COVID. So I think, as Jean Adams and colleagues have pointed out, once we acknowledge that ultra-processed food is the dividing line, then suddenly the problems faced by nutrition policy, in a way, they become much bigger. It's not about these narrow issues of reformulation, of attacking these individual nutrients or substances such as sugar or fat. It's about looking at food in these huge holistic ways, many of the things that Bhavani has just pointed out, to do with equity, to do with justice, to do with, Jean Adams points out that the question of whether somebody eats home-cooked food every day may not be just a matter of skills. It may be to do with working hours. It's to do with equitable pay. It's to do with access to food. It's about food deserts and food swamps. But there is also an additional problem which can't be solved without any of these other problems being solved. But I think it's a part of the jigsaw that we don't always talk about, which is preference. So often we talk about problems such as type 2 diabetes as lifestyle illnesses. And this drives me mad, because really this is not some frivolous lifestyle choice that somebody has decided to go out and habitually eat the foods that will sicken them. I mean, it makes it sound as if it's some kind of trivial choice people are making. Often people have no choice at all. But part of what's happened is that the makers of these ultra-processed foods, they've not just captured our wallets, they've captured our supermarkets. They've also captured human palates and human preferences. And this happens from a very, very young age. So I'm now going to link into what Sheila mentioned. I'm the founder of a charity called Taste Ed, which is based on a system called Sapura, which is a way of teaching children about food, which has been around in the Nordic countries for decades. And it's really about allowing somebody the space in which to change their preferences and to discover the joy of healthy food in all of its diversity. Well, that alone clearly wouldn't be enough if you don't also have access to healthy food. And the problems that both Anna and Bhavani have raised, that our food system is failing us because people on low incomes very often can't afford to buy fruits and vegetables. But the missing part of the jigsaw is, what if you did have a scenario where the school feeding systems are working for children and where they are being offered fresh, healthy, nicely cooked food with a range of diverse plant foods on their plate? But if they don't want to eat those foods, they still won't get the benefit of them. And something I've seen again and again in the Taste Ed classroom is you'll have children say things like, "Oh, I've never felt a real peach before. I've had peach-flavoured medicine." Or you'll offer somebody a fresh orange and it reminds them of orange-flavoured candy because they've never actually seen the real thing. And I just wanted to end this introduction with a kind of note of hope, which is the other thing that we've seen, and this is backed up by numerous studies, is that human preferences are remarkably malleable. And there is huge hope that if by some miracle governments could step up and be braver and take on the ultra-processed food industry and see, as Anna says, they do have a responsibility for giving their citizens the nutritious food that we all need to flourish in this post-COVID era. Humans are absolutely capable of learning to love kind of healthy foods that have somehow been fed a line that children will never learn to love. And I just wanted to show you what we do in Taste Ed is the first step is just getting children to know fruits and vegetables. So this is a 10-year-old child interacting with tomatoes, and we might just bring a tomato into the classroom, and instead of saying, "Eat this tomato," we say, "What does it look like?" And for the very young ones, they might say, "It's red like Spider-Man." Or it looks like a globe. Or once one girl looked at a little string of cherry tomatoes on the vine and said, "The stalks look like stars." And suddenly we all looked, and the stalks looked like stars to all of us. And the point is that once you've gone through this process of getting to know foods, you want to eat it. And this 10-year-old has written, "One tomato reminds me of a pumpkin, and one is like a Chinese lantern." And I'm not in any way suggesting that this is the solution or the magic bullet, but I'm saying that when we speak of food systems, the thing that makes me hopeful is that a food system is not just this amorphous question of supply, which is often failing us at many, many levels. A food system is also all of us. It's human beings with appetites and desires and those desires can change. And it's only part of the picture. But if we want to build a future with biodiverse and just and equitable food supply, we also need to build a new generation of human beings who want to eat in a different way.
Thank you very much, Bea. I'd be very interested in how Bhavani and Anna and Alison react to that idea of the entry point that Bea has chosen, which is to go in at a very young age, work with children, and sort of take a child's palate. As she says, corporations have captured the food industry, big food has captured it. Is that the way in? Because otherwise, it seems to me that we're in a chicken and egg situation. You know, we have people, we've built an unfair global economic system. The rich get richer, the poor get poorer. So therefore, we have to have cheap food to feed them, which feeds into the food industry. So to go back to my simple question, can I begin with you, Anna, maybe? How do you think that adds up, you know, when you think in global terms? Anna?
Okay, can you hear me now?
Yes, I can just hear you now, yes.
Okay,
and
good.
What do you think of Bea's, this entry point that she has of, you know, of actually of recapturing children's taste buds, as it were?
Yeah, you see, the food industry has studied a lot human behavior and human likes and dislikes. They know, for example, that when you combine salt, sugar, and fat in a certain proportion, you can easily hook them to the point that it's almost like an addiction. They have studied all of this. They know what combinations to use to get us to eat certain foods. And so really, I think, and they start very early. And the second thing they do is that they make these foods very cheap. Now, go into your grocery stores and try and get to where the cashier is. Look around it and see what kind of products you see around the cashier. Here's a mother who comes with the children and they see all of these around them. You see, psychologically, they are capturing the mind and the brains of the child. They are seeing it, they are hearing it, they are tasting it, and it's so cheap. If we can find a way of reversing that, I think it will help. And certainly I agree with, what was it, our last speaker, by saying that we should start with children. If we can find a way of de-abusing this kind of thing, that we should all eat sugar and fat so that we don't get, we can pull ourselves out of this addiction, I think it will help. And we cannot start, but we have to start early. Start with the children. Start with the children. Children don't have to eat sugar.
Alison Aubrey, does this resonate with you?
Yes, everything she just said. You know, what can I add to that? I think, you know, if you see what's happening in the US, just in terms of restructuring what children eat in school, it's been shown that you can cut sodium by slowly over time, and children won't even notice it, right? Because the palate becomes accustomed to this ultra salted food. But if you cut it by 10% and then you cut it by another 10% and you cut it by another 10%, there's just a different norm entirely, right? And there's studies to show that if you give children sugared cereal versus giving them unsugared cereal, and this is a study done years ago with the Rudd Institute, you know, and then you ask children, well, make the cereal as sugary as you might like it. They will put on less sugar than what the prepackaged sugary cereal already contains. So yes, and more yes. We seed our taste buds at a very young age, and to be, you know, I'm trained as a science reporter, so I kind of hate to go here, but I have 3 children ranging in age from 9 to 19. And I can tell you that, you know, the first you hold off giving your children all this ultra processed food, right? You're trying to be mindful. And then they go to their first birthday party and eat like a big piece of chocolate cake. And you see the look on their face, like, how could you have denied this, of me? I mean, there's no doubt that sugar is quick calories to the brain, and we've evolved to like the taste of it. I mean, I'm not telling you anything you don't know. So yes, these things are highly addictive, and we can control our children just for a few key years, and then they're out into the world and they make their own choices. And even if you raise kids with having only healthy choices in the house, believe me, the first time they get pocket change in their pocket, they will go to the corner store and try to buy a sugary drink. So you're sort of fighting upstream, because the bigger cultural environment is sort of norming this consumption of ultra processed food and sugary drinks all the time. So yes, families, parents, schools can try to sort of set children in the right direction, but the food environment is sort of a 24/7 inundation of cheap calories that often come with a lot of sugar, fat, and salt.
Well, Bhavani, we slightly changed it when we get to you, because here is Alison. I mean, we have B saying, we can, if we, as a whole society, we can intervene at an early age. Tastes are flexible. We can change children's tastes. But Alison saying, let's concentrate, let's think about, what the culture that exists at the moment, which is enormously powerful. And this comes back to what you were saying about a food system which is not resilient, which is enormous, and which has all these inherent problems and produces these ultra-processed foods and linked to disease. How do you respond?
Yeah, no, I'd go along with a lot of what has been said so far. I completely agree that if there's any hope of changing diets, it's got to be done at an early age. In economics, we've got the concept of habit persistence. So the idea that what you consume today is very much a function of what you've been consuming for a long time. And so once you get into adulthood, chances get slimmer and slimmer that anyone can actually realistically change your diets, which is why when some of my students come and say, I want to do my thesis on a novel food, seaweed or insects or whatever, and I think this can completely revolutionize things, I say, well, what is the strategy there? Because you're not going to change adults into eating alternative things. You have to start early. So that's the only hope. And so we really need to think about the food environments that kids face. And quite a lot of times, certainly in the United Kingdom, it comes down to school feeding, school lunches and things like that. Following on from what Alison was saying, I've got a 10-year-old daughter who refuses to eat anything that she hasn't encountered in her school previously. So during lockdown, I've been trying to feed her healthy wraps and things like that. She says, well, we don't get that at school. I'd like a cottage pie, which I don't even know what a cottage pie is properly. So I've got a real struggle on my hands. And so that reflects the environment that they face at a very young age. And that programs you for everything that you eat from then on. So yes, absolutely. We have to start, the strategy has to start at quite a young age. For that, we need to figure out what the food environment is that kids are facing. And I think schools have an enormous responsibility there and have an enormous chance to change things. And that does happen in some parts of the world. There is, there are healthy school initiatives, but are they doing enough? Probably not. It took a celebrity chef in the United Kingdom a few years back to really put this on the agenda. So it is possible to do it. It requires a really concerted effort, and it requires some visionary thinking. But yes, I completely agree. That's a good way to go.
Well, this brings us to, we may as well face this head on. We're talking about, as Bea says, a food industry that produces this highly ultra-processed food, which the overwhelming evidence that this is a disease-causing kind of eating. It is just a small number of companies which dominate this food production, and this group, they are bigger than any one nation. They have enormous political influence, and I mean, Alison, you talked about this. That is the free market production of food is the food system in the United States. Well, I mean, some people would argue that it isn't a free market. It's antitrust legislation was wiped out by Ronald Reagan, and gradually corporations have become people as far as the American Constitution and the legal system is concerned. How do you begin to either change those industries from within or control their power? B, you must have thought about this.
How do we begin to take on the ultra-processed food industry? I mean, it would start, as Anna said, with governments being much bolder and braver. And the very first thing is even acknowledging the phrase ultra-processed. I mean, the food industry, as you know, Sheila, has incredibly powerful lobbyists, and they are everywhere, some of them out in the open and some of them covert. And they don't even want us to use this phrase ultra-processed. They've been sort of doing all sorts of this. How do we begin to take on the ultra-processed food industry? I mean, it would start, as Anna said, with governments being much bolder and braver. And the very first thing is even acknowledging the phrase ultra. Sorry, Sheila cut off then completely. Hello?
Hello. No, I can hear you and see you. Yes, you cut off.
So what happened was, did I cut off? So I got replaced, I think, by Christopher Gardner, who maybe is on the next panel. That was really strange. So I think governments need to be bolder. I think it's never going to be just one intervention. I wanted to mention, Bhavani had said, there've been these few positive interventions that have given us some glimmer of hope. And even though I've mentioned this one tool in classrooms and preference, it's never just one thing. The food system is this vast thing, and you need multiple interventions on multiple points of it. But the city of Amsterdam offers a moderate amount of hope in that through something called the Healthy Weight Programme, it became one of the first cities in the rich world to bring down child obesity, I think 12% over a period of a couple of years, which is, it doesn't sound like much, but it's fairly significant given that the upward trend of child obesity is all in the opposite direction pretty much everywhere else. And they did it with a whole raft of measures, one of which was saying that the only drink children have in schools is water, one of which was working with the food industry, and companies such as McDonald's agreed that within a certain radius of the schools involved, they would not sell a child anything other than, I think, an apple or plain water. And it's astonishing they managed to achieve that agreement. They worked with sports stadiums to get rid of marketing. They worked with families to give them much more helpful, practical information on the amount of sleep children needed, on how lots of these parents believed that these fruit snacks that were being marketed were healthy, and they broke it down and said, no, actually, those are not healthy things to eat. And bit by bit, all of those changes made a difference. But the people involved have said in some of the reports I've read that maybe the single biggest thing was changing conceptions of what's normal. And I think Alison referred to, you used this word, normalizing. Tim Lang often speaks about the problem is that we have normalized poor diet, and we've even normalized diet-related ill health to the point that we just think it's okay that large sections of the population have type 2 diabetes. And suddenly, the horror of COVID has thrown a new, really scary lens on that, because we see that having an underlying condition such as type 2 diabetes places you at greater risk, not just of long-term health problems, but of dying if you get this horrible disease. So I think we need to change what's normal. It needs to start with governments.
Alison, you talking about the normal. Do you think it's possible in the United States to change what's normal? I mean, you don't exactly have a very helpful government, but, is it possible?
Absolutely, it's possible, but, we're not a very homogenous country. I mean, we're a country of 330 million people. And as we've been talking about, the way you eat is sort of determined a lot by socioeconomics, right? And so I would argue we've been in the middle of a food movement, a better for you food movement for as long as I've been covering this, right? I mean, I've been covering this stuff 15 years and I'd say for at least 10 of that the focus has been on, oh, people are caring about food more, and look, food is at the center of what we're doing, while we've left behind a whole lot of people. And so you guys started out this conversation about how few companies control how much of what we eat, and just to weigh in on that a little bit. I mean, I think if they're part of the problem, they also be part of the solution, right? I mean, look at what Coca-Cola and Pepsi are doing. They're trying to promote 0 calorie, right? Promote water drinks. And we could get into a huge debate about whether that's progress and why don't we just all fill up our water bottles from our faucet? Why is anybody selling water? But I would just argue that there is sort of an awareness, and awareness is the beginning. And big food companies, I mean, Nestle calls itself a wellness company, right? They're trying to get into the wellness space. They're trying to understand food density, nutrient density, rather. I believe that these companies are in a different place than they were 10 years ago, just because consumers are putting more pressure on them to change the lineup of products. It's not enough by any stretch of the imagination, but it's a start.
What do you, but COVID has shown us the link between type 2 diabetes, obesity, and your chance of getting the disease and your chance of dying from it. Do you think it's a kind of punch to say, actually, food really is significant? It matters. We've had this conversation for a long time. We've both been journalists covering this for a very long time. But now suddenly it's real and raw. People are dying in numbers because of conditions, and we know that's rooted in inequity. But is there a possibility for change in that?
Okay, so I mean, I would say, to me, that one of the biggest differences when I look at your system compared to our system is that I believe to fix this problem, I mean, if we're going to talk about that, if we're going to medicalize poor eating in terms of metabolic disease, which we have, well, then we have a healthcare system that's supposed to be fighting disease and making us well. I would argue that in the US, we have disease care, not healthcare, right? We wait for people to get sick and then we try to fix it. Well, everybody in this country is interested in trying to shift that into prevention. And how do you do that? Well, you treat food as medicine, right? I mean, there was this amazing study done at Geisinger Health in Pennsylvania, in a county where a high number of people have elevated A1C and a high number of people are low income. And we know the overlap between diabetes and SES. So this particular program went on for a year. Everybody who had elevated A1C and was food stamp eligible received free fruits and vegetables for 1 year. They also received all kinds of training about how to cook these foods and how to change their diet. They built in everything we know about behavior change, which, as Bea mentioned, it's never one thing. It's always a whole bunch of things. But basically, this program at Geisinger took this group of people who had uncontrolled diabetes, gave them fresh fruits and vegetables for a year, and at the end of the year, reduced people's A1C down to a level where some people went off medication, and everybody had lowered their A1C significantly. And this was through lifestyle. So, look, if we're going to leave it up to food companies to try to, make us better by selling healthy food, we're going to be waiting a long, long time. The more proactive approach is to say, look, lifestyle disease is killing the vast majority of us, and we've got to get a handle on it in prevention, and this is the job of healthcare. Now, to do that, in the US, most of us get our health insurance through our employer, right? And the churn of that market is 7 years. That means that NPR doesn't necessarily care. My employer doesn't necessarily care about preventing my diabetes today, because by the time I become sick from the knock-on effects of diabetes, by the time I need a toe amputated, I'll be 65 or 70, and that will be Medicare's problem. That'll be the government problem. So our healthcare system isn't set up to prevent disease. And until our healthcare system is set up to prevent disease, we're going to be stuck here.
That is not stuck in a not very good place. Anna, you looking out at the United States. I mean, you work there. You are. A lot of your work is concentrated on what is going on there, but worldwide, what Alison is saying, does it resonate with what you see elsewhere?
Yes, thank you very much. Indeed, some have said that if you look at the current generation, if we don't take care, we will, because of the way we are eating, we will be the first generation where the younger generation will have a shorter lifespan than their parents. This is not supposed to be. We should live longer than our parents. But the way we are eating, the younger generation may have a shorter lifespan than their parents because of the way we are eating. Now, the issue of non-communicable diseases and NCDs is on the rise in Africa. In fact, if you look at about 8 countries in Africa have faster growing incidence of non-communicable diseases. We have always thought about Africa and undernutrition. Well, it is changing because the diets are changing very fast. Not only that, if you look at the government policies, it is cheaper, and I've done this, it is cheaper. You can get a sugar-sweetened beverage costing about 20 cents. A small size to medium size watermelon in a country in Africa will cost about $2 to $3. How on earth do you encourage a mother to feed their children fruits and vegetables when they can just buy a sugar-sweetened beverage for 20 cents? So it's also even developing countries are also affected in these ways. Not only that, if you look at the government policies, for a long time, and this is something that FAO is now trying to change that policy on production. We have focused a lot of countries have focused on producing calories. So, filling the stomach, not nourishing. So long as you can fill the stomach with high calorie foods, that has been it. So you can see that a lot of the country policies are on production of staple foods, high cereal foods, that they do not invest in the fruits and vegetables, the nuts, the seeds that we want people to eat more of. As a result, these staple foods are so cheap. And for societies where a lot of people are poor, you see that, and where they spend a high amount of their income, about 60% or 70% of their income on food, they are more likely to buy the staple foods than consume the nutritious foods that we want them to eat, because they just cannot afford the fruits and vegetables. Governments do not invest there. Fruits and vegetables are produced by women on a small scale, subsistence living. So it's very expensive. It's perishable. So the main farmers do not like to go there. They'll rather produce the staple crops, which will give them stable income. And so the whole policy in many of the countries are not geared towards enabling the population to have a healthy diet that is affordable.
Okay, and I wanted to bring Bhavani in here, but looking at the time, I hope that we need to go to questions from our audience, because there's a lot of them. And Navjot is going to come up with... Navjot, can you tell us, give us a couple of questions?
Yeah, I mean, we've had some really thoughtful conversation going on in the chat, particularly related to this idea of, children as entry points and trying to minimise the influence of ultra-processed foods in people's diets. So just some of that debate has centred around things you've spoken about, like the affordability and food environment, but also what can we do about marketing of foods and marketing healthy foods, particularly, more on education, support for education about food initiatives, and addressing convenience as well. So I think there's this idea that someone here has mentioned changes proposed have to feel possible, attractive, easy, and affordable. Where should we start? And then also equitable as well. So if we're doing more food preparation, is that more likely to fall on women? There's quite a lot there.
It's almost as though this 1 hour was supposed to make the world a better place. Well, we're going to try. Bhavani, can you address some of those issues? How do we improve marketing? How do we get the fruit and vegetables to be more convenient, to be more accessible?
Yeah, it's a difficult one, but I think a lot of people have been thinking about this for a while now. The first thing would be it's really the relative prices that matter. So it's not just how much fruit and vegetables cost, but also how much they cost relative to getting your calories via ultra processed foods. And, so it's a relative thing. And ultra processed foods, of course, have become extremely cheap. And so if you're hungry and you want to satisfy your hunger, then it's easy to get ultra processed foods and then just fill your stomach. So as an economist, for me, the first thing would be to see to it that foods are priced on the basis of their environmental and health costs. So the argument is that, first of all, many foods are environmentally unsustainable. So they're produced by creating pollution. So the price needs to reflect those costs that they impose on the rest of society through the environment. But there are also health costs. So especially if we live in a publicly funded health system in many countries of the world, when people are obese, then that's a drain on the public exchequer. So the price needs to reflect that. But also the fact that people just don't have enough information to act on healthy eating. So food has become so complex now that if you pick up a bag of Doritos or whatever, it's really hard to figure out what exactly is in it. And you look at a big panel at the back, the most educated person would be turned off. So really, governments have a role in making sure that that food is priced in a reasonable fashion that reflects the environmental and health costs. And that, to some extent, for me, will equalize will sort of make it fairer. Presumably fruit and vegetables, the relative prices would go down, the relative prices of those less healthy foods would go up. So that is a start. Marketing of fruits and vegetables. This is a difficult one because there's no universal. So we did a review of literature about 10 years back, what has actually worked in Europe. And we found that everything's worked in a fairly piecemeal fashion. So if you take a TV advertising watershed times when you stop advertising on TV, that works in some countries, but it doesn't work in other countries. So trying to get a universal fix on that, how do you prevent that marketing is a really difficult one. But I think the key there is just as much to make sure, again, a level playing field for me, the healthier foods, the fruit and veg. Can we get some positive advertising out for them? Can we get them positive marketing out for them? That goes back to what B was talking about. Can we make them more attractive to children, which is, in a sense, a social marketing sort of endeavor? Can we level the playing field in that way, both in terms of pricing as well as in terms of marketing? So yeah, that's what I think might work. But there have been so many experiments around the world, it's really difficult to find where the evidence is very certain in terms of things like marketing, and that's the big challenge that we have. But I think it's a drip thing, really, just to, if you think about it, 30 years back, smoking was fairly commonplace, was not that bad. You could smoke in public, you could smoke everywhere, in classrooms, in lecture theaters, in hospitals. That drip has eventually brought it to a point where it's not acceptable anymore, and it's a very rare thing now to see smoking in public, in places where people congregate, where you can affect other people. And just that way, we need to keep plugging away. Unfortunately, it's a long fight. I think we're doing the right things and we're having the right conversations, and we just have to keep at it because this is not going to be won quickly. Yeah.
Time is drawing to a close. One last question from me to all of you, which is, do you think that we've reached a point in different parts of the world where the cost of this neoliberal, the market is the answer to everything economics, is becoming so great that there is the possibility of change? You, Bhavani, have just talked about food needs to incorporate the cost of what eating that kind of food does to your health, what it does to the environment, what it does to climate change. Have we reached that point? B, can you, and this is very short.
I really hope, I very much hope that we have reached that point. I mean, I wanted to say something also in response to that first question about equity, because this always comes up. If we ask what is the opposite of ultra-processed food, it's home-cooked food. this is problematic if we imagine that that's something that has to be done by a hard-pressed individual woman alone in her kitchen in the unfair way that has been done for generations. But there are a couple of things I would say in response to that. The first of which is that another hopeful part of the story that often doesn't get told is that if we look at men as opposed to women, around the world, home cooking is a growth activity for men. And we need to do as much as we can culturally to support this anywhere it's happening. It's about time too. But the second thing is that if the opposite of ultra-processed food is home-cooked food, if, as we now know, diets high in ultra-processed food are causing all of these problems, well, surely home-cooked food is something much bigger than individual kitchens. And yes, we need wonderful school feeding programs, but also adults need to be fed. And I would love to see a return of and expansion of the idea of a works canteen. I think it was Alison who said that her employer only really cares about her health insurance in a sort of pragmatic way. But wouldn't it be amazing if these large corporations and institutions that so many people work for actually cared about their employees to the extent that they gave them a subsidised, healthy, home-cooked lunch every day? I think that would be an amazing thing.
It would be amazing. Alison, do you think we've reached a point where the cost of this kind of economics could make change possible? Alison? I think we may have lost Alison. So Anna Larty, do you think we've reached a point, Anna, where the cost of eating this kind of food might give governments pause about putting some oomph behind a fight for getting children and adults to eat better?
I think we are almost there. People are questioning. People are asking, why all of a sudden are we seeing diabetes prevalence increasing like so many hundred times? The fold of increase in diabetes is not what we've seen in previous years. What is happening? So consumers are asking. Okay, but what I want to say is that ultimately consumers are responsible for the way they eat. So we should provide them the information that they need to be able to make the healthy choices that they need to make. Consumers demand producers. If they demand and push hard enough, these companies will listen to them. Very often we are not empowered, and we have to find a way to empower the consumer to demand what is good for their health. And I believe it will change things.
Bhavani, you're the economist. You get the last word. Are we at a point of change?
Never let the economist have the last word. It always ends in disaster. No, absolutely. I think economics itself is changing in many ways. Over the last decade or so, there's been much more an alternative view, if you will, of economics. Very prominent economists coming through are talking about some slightly different things, about a middle path, if I may. And I think that really is where most solutions in most parts of the world lie. It's not this extreme or that extreme. It's typically the answer lies somewhere in the middle. And I think market economics has some things to offer. There are local chains and local solutions have something else to offer, and we need to find a way to get them to coexist and get the best out of them. So I think things are moving in that direction. I just came off, before I came to this meeting, a conference where Professor Angus Deaton, who's a Nobel laureate in economics from a couple of years back, was talking, and he was again talking about how globalization, people have realized, even the most hardened economist has realized that globalization is at best a mixed success, has been in terms of the economics that it entails, and that so it's becoming more mainstream now. So yes, there is hope. I think we're having the right kinds of conversations. So I am hopeful.
Well, thank you for the last word. Thank you to all the panel. I'm sorry that we didn't answer and discuss more of your questions, and I feel at fault that my technology got me onto this platform rather late. But thank you all. I hope there'll be more discussions that follow from this. And now I will hand back to the editor-in-chief of the BMJ, Fiona Godley.
Sheila, thank you so much. And thank you to all the panelists That was a really passionate and informed and, in the end, perhaps hopeful discussion, but introducing a real sense of urgency to the need to change our global food system. So thank you very much indeed, and also to Navjoyt for looking after the chat. Now it's time to take a break. Only briefly, if we could get you back at, I hope we're still on for 16:55 Central European Time, for our final panel discussion on improving nutritional research and managing conflict of interest. See you then.
Bye-bye.
Bye-bye.